Caring for the Children of Abraham, Chapter 6. The Battle to Save Ari. Ari was a beautiful, handsome, and intelligent human being, the best. I was called to see him in the middle of the night. He was tall, slender, athletic. I learned later that he was the best basketball player in Haifa. A medical student or pre-med, I can't remember. Light skin, dark hair, good looks. Reminded me of movie actor Jeffrey Hunter. He had a bandaged neck wound, a small tracheostomy tube with a trocar-like ventilator adapter poked into it, connected to a small pressure-regulated ventilator, laboring unsuccessfully to ventilate him. He was apparently paralyzed from the neck down. I examined him. His chest motion was slight with the ventilator. There were thick yellow-white secretions blowing out of the tracheostomy stoma. The tracheostomy tube was metal and had no balloon to close the trachea from pharyngeal secretions. The inflating oxygen was escaping from his neck. His chest was barely expanding. The percussion note was dull. Over both lungs. The lung fields to auscultation had little sound of air movement. Over the bronchi was mostly bubbling, gurgling, coarse sound of air escaping around the tube through the thick secretions above. Ari could feel my hand on his shoulder, but he could not feel or move below that. His skin was hot to touch. The first thing he said to me was, "I am drowning." He would speak when the machine blew air past the tube and his vocal cords. Ari's nurse, Ava, had called me. She told me that Ari was a lieutenant paratrooper who had survived the Battle of the Old City. The fighting had been fierce. There were many Israeli casualties. Ari had fought into the Old City, up the Via Dolorosa to the top of the hill where Christ is said to have been killed. The next day after the fight was over, he and his men were trying to get non-combatant Arab civilians out of hiding in caves around the city. Someone in a cave shot Ari through the neck while he stood calling into the cave entrance in Arabic for those inside to come out. The bullet passed through his neck, turning a vertebra through his spinal cord. His spinal cord was damaged at the cervical 5-6 level. He would not move again, I thought, might not breathe or talk, and he was dying of pneumonia. Let's take him down to the recovery room, I said to Ava. He needs close attention. I want him close to us in the operating room and the recovery room. He needs a proper endotracheal tube ventilation. We've got to clean out those secretions and give him some antibiotics. Ava did not need convincing. Ava was 50-something, brown hair, open face, large eyes, and flashing smile that showed her white teeth, and her whole being seemed to say that she would work with me, be good together to save this wonderful boy. Ava was English. She had come to Israel during the Second World War as a truck driver. She stayed to become an excellent nurse. We pushed a bed together through the hallway while I ventilated Ari with a breathing bag. Ari's bed had a wheel out around it, clunked each time it came around. We moved Ari to a room adjacent to the recovery room that we started calling the ICU. We put in a properly cuffed endotracheal tube, actually tracheal tube through the stoma, and connected it to a pressure-controlled ventilator that could do the job. We ordered a chest x-ray. The lungs were whiteout. Started broad-spectrum antibiotics and gave him postural drainage and percussion. Two of us working together used an artificial coughing technique that I had learned from Scandinavian chest physical therapist at Massachusetts General Hospital in Boston. We suctioned his airway with the coughing and got copious, thick, yellow-white secretions out. We were getting some air into the lungs. The coarse, loose airway sounds were less, and we could hear the fine crackling sounds of pneumonia in the periphery of the lungs. Another x-ray looked better. Now we could see functioning lung and patches of pneumonia. Ari was a fighter and wanted very much to live. Ava and the rest of us worked hard with Ari. We got his lungs cleaned up. He had been originally passed over during the crisis by the triage system for people who needed surgery before he did. He eventually had surgical fixation of his neck. His level was still C5-6. He perhaps had some use of his diaphragm. Ava taught him to breathe using a method called frog breathing, a kind of swallowing air into the lungs. We were able to wean him off the ventilator and even remove the trach tube. His wounds healed well. He had to have a catheter in his bladder and bowel care. All things considered, Ari's critical care was over. We met with Ari's family, his girlfriend, and his parents. In the months after the war, the Israeli army sent Ari to the University of Michigan, Ann Arbor, for rehabilitation. At that time, Ari was fitted with a platysma muscle-stimulated prehension device, twitching a neck muscle. He triggered a device that moved his fingers. He was mobile in a motorized wheelchair. I last saw Ari and his mother in Ann Arbor. He realized that he had achieved the extent of his recovery. He was depressed. I believe he returned to Israel. I don't know what became of him there. To be continued.